What does acute and protracted withdrawal from benzodiazepines look like? My name is Dr. Ruth Dotton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of safety prescribing when clinically appropriate. And one of the questions that has come up is, what does acute withdrawal look like? What does protracted withdrawal look like? And how can we distinguish between the two? So I've talked about how acute withdrawal from benzodiazepines can be very dangerous and even potentially deadly. So this is usually going to start within hours to days of the person's last benzodiazepine dose, which is usually related to how high of a dose someone's taking, what is the duration of action of the medication. So if you're on a short-acting benzodiazepine, something like lorazepam or alprazolam, then you're going to experience the withdrawal symptoms pretty quickly. Whereas if you're on a longer acting benzodiazepine like clonazepam or Valium, then it could take a couple days before those withdrawal symptoms become apparent. And what those acute withdrawal symptoms look like is going to vary over those first few days of withdrawal. So usually within the first 6 to 48 hours, you're going to develop those initial symptoms of acute withdrawal. So this might look like tremors, anxiety, panic, restlessness, insomnia. And then over the next 2 to 14 days, these symptoms are going to escalate to a peak before they start to improve. And it's during this phase that there is the risk of potentially very serious complications, things like seizures, hallucinations, delirium, intense cravings. And so we know that medical supervision here is critical. However, historically, when we've thought about how to manage this acute withdrawal, we think, okay, we'll use a benzodiazepine taper to prevent these really dangerous complications of acute withdrawal. And so we might do a taper over a period of a few days to several weeks at the most until the patient is through that acute withdrawal period. Now, it's pretty well known that there still can be lingering symptoms of withdrawal for months and months. So this might include things like depression, brain fog, fatigue. But what we're coming to understand further is that this protracted withdrawal period can present with really intense symptoms that affect almost every system of the body and can last for months to years. And so what increases the risk of this happening is if that initial benzodiazepine taper is done too quickly. So if you've seen my other videos, you know that I talk about doing a hyperbolic taper, which means decreasing by a percentage of the dosage rather than a set amount. So basically, if that taper is done too quickly, which in most acute or inpatient medical settings, this is going to happen too quickly, then you're at significant risk of this protracted withdrawal. And so what does this look like? So of course, there can be that persistent depression, anxiety, insomnia, and panic. But there also can be significant cognitive issues, things like memory and concentration issues. I've had people tell me that they forgot how to read and write. Severe brain fog, there can be hypersensitivities to light or sound. There can be neuropathies, numbness, tingling around the body. There can be experiences of depersonalization and derealization. There can be significant gastrointestinal symptoms, things like gut motility issues. There can be tremors, tinnitus, muscle aches, muscle spasms, and more. Your brain is also more sensitive to other neuroactive medications or substances. And so a lot of times people who are in this state can't tolerate other psychiatric medications or even other somatic medications that are going to have a CNS effect, or even certain foods that are going to have a CNS effect, things like saffron or foods rich in vitamin D. And once you're in a state of protracted withdrawal, it can take months to years to recover. And the treatment is largely supportive, making sure that that person stays safe, trying to manage the symptoms as much as possible, making sure that they have social support and encouragement that things will eventually get better. But of course, this is really hard, that there's not much that we know of that can hasten the timing of recovery. So the best thing to do is to prevent this protracted withdrawal by doing a slow hyperbolic taper only as quickly as the patient is able to tolerate. If there have been things that have helped you or harmed you on your protracted withdrawal recovery journey, then please share in the comments below. I'm also putting together an email list for those of you who are interested in my content so that if I have future resources or courses or offerings, I can share those directly with you all. So if that's you, send me a DM with your email and I'll see you in the next one.